I'm honored and I'm very humbled to serve as the 18th United States Surgeon General, especially during this historic time as we are making changes in financing and delivering our health care. I would like to thank President Obama for the opportunity to serve, for Congress for their unanimous support, and for the previous Surgeon Generals who walked before me, particularly my medical school professor and mentor, Dr. David Satcher. Most people often ask me how I got involved in all the things I do, so I thought I'd tell you. When I was an intern, I attended the Medical Association of Georgia's annual meeting, and one of the intense issues that was being debated was that sexually transmitted diseases needed to be taught in medical school. Well, I stood up in a room with just a handful of people and told them I'd never seen syphilis or gonorrhea except in a textbook. The resolution passed, and they sent me to the AMA to speak to the same issue. And again, it passed. And within 6 months, every medical school in this country was encouraged to include sexually transmitted diseases as part of their core curriculum. I learned that one person can make a difference. Whether it's in medical policy or medical practice, and I learned that I could make a difference in medical practice when the National Health Service Board sent me to biovacuum. It's a pretty place, but it's a poor place. I found a community of working poor, too poor to afford medical care, but too rich to qualify for Medicaid. I like the people, I like the community, and I wanted to practice medicine there. So I quickly learned that practicing medicine wasn't just sewing up shark bites. I had to deal with the land sharks, the regulators, the reviewers, the red tape dispensers, and what I sometimes call the hemorrhoids, the lawyers. But I had to keep involved, keep active in organizations like this, any organization that would help me help our community. And so I also learned that there were things that my prescription pad just wouldn't take care of. Clean water, clean air. Those things are really important to our patients just as much as writing a prescription for a blood pressure pill. I had a patient, Donna, who was about 26 years old, young white girl with 2 kids. She had seizures, and so her seizures were under control until one day she came in and she said she had started having seizures again. I said, Donna, what happened? And she said, well, I have patients draw things for me, so she drew it out. She drew her pills, what they looked like. They used to be striped in, but now pharmacists gave her a different pill. Because at that time, Medicaid had gone to an HMO, and they changed her medicines to generic. She didn't know which pills to take because she couldn't read. And that's how I knew that prescription pad was enough. Another patient was Willie. Willie was 40-something years old, born with a speech impediment and didn't really go to school, so he was considered a little slow, but he would do anything you asked him to do. You say, Willie, don't eat the fat, grease. He would do exactly what you said. But he worked as a handyman, he cut his hand, which he got infected, had to go to the hospital. When it was time to let him go, discharge him, the social worker, who happened to be a Catholic nun who wore her habit, asked him, Willie, is there something we can do for you? You need a home health nurse? What is it? He said, we will teach you to read. I knew that we had to do something in the community to get adult literacy taken care of. More than my simple prescription pad could do, and more than we could do alone. We needed other organizations, the entire community to come together. And the last patient I want to tell you about is Mrs. Smith. She is 40-something-year-old, short, African-American woman who works in our school system as a janitor, custodial services. She had what we call a slip disc or ruptured disc and was having back pain. She called me on a Saturday and she says, Dr. Benjamin, I could hear the pain in her voice. She says, Dr. Benjamin, I really tried. I went to that specialist you sent me. I'm trying to lose weight, like you said, I really am. But the pain is just too bad. Can you get me something stronger than this ibuprofen? So I told her I'd give her a prescription. I called it in and told her to come and see me. This was a Saturday. I said, come and see me Monday or Tuesday. And on Tuesday, sure enough, I walk in the exam room and she's there standing, leaning over the exam table in a lot of pain. How are you? She says, I'm still hurting. And I said, well, did the medicine help you? She said, well, I didn't get it. And I said, why? She says, well, I didn't have the money. I said, but you have insurance. You have the school. You have insurance. Yes, I know, but I didn't have the copay. But I promised I'm gonna get it on Friday. I get paid Friday. I promised to get it. So I stepped out of the room, asked my nurse to go over to Jim, our pharmacist across the street, to get her medicine for her. She brought it back, and I gave it to her, and her tears rolled up in her eyes. And she says, oh, Dr. Benjamin, I just didn't want you to do that. I'm so embarrassed. I'm so embarrassed. And then I realized I had made a mistake. It was a cultural mistake. I took her dignity from her. I really shouldn't have done that. And even if you have the same race, you can still be culturally incompetent. So I had to backpedal and try to get out of that one. So I basically said, well, you know, it's okay. We have a small pot of money. People donate money just for this. And if you want to put the money back on Friday when you get paid, it's okay. And she was fine with that. And she was okay. And as I was walking out of the room, like every doctor here will know, she says, oh, by the way, we know something's coming up. So I said, sure. She said, can I ask you something? Sure. She says, well, I need a work excuse to go back to work. I said, sure. You know, like she's still leaning over the table in pain. And I said, sure, you want to, today is Tuesday, you want to get your medicine, stay home a couple of days and go back on Thursday or Friday? She says, oh no, we have to strip those floors tonight. I've got to go to work tonight. These are the people who are keeping the floors for our children clean. These are the people that we're fighting for health for. We know about the uninsured, but we don't often talk about the underinsured, people who are keeping our entire country going. So as you talk this week, people like her